Leg cramps, causes and prevention. Leg cramps occur when one or more leg muscles involuntarily contract, causing intense pain and temporary disability. Leg cramps are typically harmless, although they go away on their own. Several at-home remedies may help relieve the symptoms. In this video, we explain what leg cramps are and what can cause them. We also cover ways to treat and prevent cramps and explain when to talk to a doctor. What are leg cramps? Leg cramps occur when muscles in the leg suddenly begin to contract and spasm uncontrollably. The symptoms of leg cramps depend on their severity. While some people may only feel a minor tick or twitching sensation, others may experience sudden, intense pain and tightness that make it temporarily impossible to use the leg. The skin over the affected muscles may also visibly twitch or distort, and the area may feel hard. How long cramps typically last ranges from a few seconds to 15 minutes or more. The cramps may occur several times before they stop entirely, and the affected muscles may continue to feel sore for 24 hours afterward. Cramps can affect any skeletal muscles, which are those over which people have voluntary control. Leg cramps can occur in several leg muscles, but they most commonly affect the gastrocnemius and soleus muscles, which are at the back of the calf, quadriceps at the front of the thigh, hamstrings at the back of the thigh. Leg cramps are more likely to occur during the night or a few hours after intense activity, but a person may experience them at any time. Are they serious? In most cases, leg cramps are not a cause for concern. However, in rare instances, serious underlying conditions may cause muscle cramps, and these conditions will require medical treatment. Causes and treatments. Doctors do not know exactly why muscular cramps occur, meaning that they are typically idiopathic or without a known cause. However, some researchers think that muscle cramps primarily occur due to one or more of the following causes: inadequate stretching and muscle fatigue. Muscle cramps may occur if someone does not properly stretch before intense or prolonged activity, leading to muscle fatigue and an imbalance in the mechanisms that control muscle contraction. Muscles contain bundles of fibers that contract and expand, allowing muscle movement. Properly warming up and stretching a muscle lengthens the muscle fibers, allowing them to contract and tighten more intensely during exercise. Stretching also allows the tendons, which are band-like tissues that connect muscles to bones, to warm up and lengthen. If tendons become too short, they can trigger cramps. When muscles are not well conditioned, or a person does not stretch them before intense activity, they are more vulnerable to fatigue, which can change the reflex activity of spinal nerves. As the muscles become fatigued, they rapidly deplete their oxygen supply, and waste can build up, which can lead to spasms. Once the cramp begins, the altered spinal nerve stimulates it to continue. For some unknown reason, these altered nerves tend to fire at night, often causing cramps painful enough to wake someone. Stretching tired muscles before bed may help prevent this from happening. Most cramps related to poor conditioning and overuse go away without medical care. To help relieve a leg cramp, a person can try stopping the activity, holding the leg in a stretched position, gently massaging the cramping muscle, resting. Dehydration. During exercise, the body sweats to release excess heat, which removes water and important salts and minerals called electrolytes. Exercising in a warm environment or just doing daily activities in a hot or humid climate increases the rate of sweating and the risk of dehydration. When the body loses too much water or electrolytes, muscle cramps can occur. Tips for treating muscle cramps due to dehydration or electrolyte imbalances include moving to a cool, shaded, well ventilated area, drinking plenty of fluids, even if not thirsty, ideally plain water or fluids rich in electrolytes, which include many sports drinks, electrolyte packets that dissolve in water, and most natural juices. Resting and trying to avoid overheating. Other causes. Scientists think that most cramps occur due to poor conditioning and muscle fatigue or dehydration and electrolyte imbalances. However, the following causes may also trigger muscle cramps. Sudden restrictions in blood flow to the muscles, which cause oxygen depletion and waste buildup. Compressed nerves. Pregnancy, during which extra body weight can strain the leg muscles. Liver disease, which can cause toxins to build up in the blood. Toxin exposure, which can allow poisonous substances to accumulate in the blood or muscles. Infection, which can cause bacteria and their toxic byproducts to build up in the blood or muscles. Certain neurological conditions that affect muscle control, such as peripheral neuropathy, amyotrophic lateral sclerosis or ALS, or motor neuron disease. Diuretic medications that can dehydrate the body or make it more vulnerable to dehydration. Statins and nicotinic acid medications that alter the levels of cholesterol in the blood. Thyroid disease, which alters metabolism. Hormone conditions. Nutritional deficiencies. People who experience leg cramps that are not due to inadequate stretching and muscle fatigue or dehydration and electrolyte imbalances often require medical care to treat the underlying condition. However, people can generally relieve most cramps to some extent with home remedies such as stretching, massage, and cold or heat therapy. If leg cramps occur as a result of using a medication, a doctor may suggest a different doses or an alternative medication. Pregnancy-related leg cramps should resolve after the person gives birth and starts to return to their original weight. A pregnant person may relieve cramps by resting the muscles or stretching them frequently throughout the day. If toxins are responsible for a person's leg cramps, a doctor may need to prescribe intravenous therapy and antibiotics. Muscle relaxants can treat leg cramps related to a lack of muscle control or liver disease. In extreme cases, healthcare care providers may give some quinine, an anti-malarial drug that tends to reduce cramping. If someone's leg cramps are due to the compression of a nerve, blood vessel, or muscle, They may require emergency medical care and surgery. Prevention. Some people are more prone than others to leg cramps. The cramps may develop even when a person is inactive. However, people can take steps to help reduce the risk of cramping. This include warming up properly before exercise, such as by walking briskly for a few minutes, stretching the leg muscles properly before exercise, making sure to stretch the calves, hamstrings, quadriceps, and muscles of the feet, stopping activity if pain or exhaustion begins, staying hydrated, especially when exercising or in a warm environment, avoiding exercising in very warm, humid conditions, stretching the leg muscles frequently throughout the day and before bed. When to see a doctor. In most cases, leg cramps are harmless and go away without medical care. However, people should talk to a doctor if they experience cramps that are frequent, severe, prolonged, meaning that they last longer than 10 minutes, disabling after the cramping stops, not related to exercise or heat, potentially related to infection, toxic exposure, or organ disease, unresponsive to home remedies.